Welcome back. And now we have a special guest. Till now, you heard the perspective from two states, state of Andhra Pradesh and state of Kerala. And now we have a perspective from Government of India's NITI Aayog. We have with us Dr. K. Madan Gopal, Senior Consultant Health of NITI Aayog, Government of India. We welcome Dr. Madan Gopal. Thank you so much for joining us today in the inaugural of fourth edition of APAC HealthTech Innovation Conclave.
Thank you.
Question to you will be that we are hearing about the National Digital Health Mission. So, what is your thought on how NDHM is going to transform the healthcare sector in India in coming years?
Uh, Shobhik, we have to just understand a perspective under which this NDHM has evolved. If you look at the National Health Policy, which has envisioned to have a digital health ecosystem and an integrated health platform, how the integration can happen. That was envisioned in 2017. And after that, in 2018, NITI Aayog has pushed a document that is the National Health Stack, which feeded into the National Digital Blueprint. The committee headed by Mr. Satyanarayan was there. It formed the National Digital Blueprint, and this resulted into the formation of this digital mission. You see, the digital mission is the highway on which all the other roads will connect so that integration can also happen. The other aspect is that once it was launched in 2020 and budget provisions of around 1600 crores have been made for the coming 5 years, you will see lot many activities in the coming days regarding this. Though digital initiatives were already there, some of the initiatives like improving the data collection, then e-hospital, e-shushruth, then the initiative platform. These platforms are already available, providing digital solutions. But after the start of this digital mission, we see that how integration of all these platforms will happen. Right now, what is happening is they are digitalizing, creating a health ID for a person. Then they are digitalizing the institution. They are digitalizing the doctor, as well as creating a structure how this can be used. If you go back that the digital aspects about the healthcare. So there's the if you go back and see the Clinical Establishment Act, wherein it has been envisioned to have electronic health records. Our vision for digital mission is to have an electronic health record for 1.3 billion people. So that's the whole overall vision, and we are moving in that direction. So digital IDs, digital ID for the doctor, digital ID for the institutions, then an integrated structure. Lot we're trying to see that how the different platforms they become interoperable and they can be talking to each other. Now, whatever things are happening in the private sector and the other spheres, they are happening in silos. Digital mission will try to see that how this structure which are evolving, they can be talking to each other. In this way, the things would be evolving. In the coming days, you will be seeing with the assured budget of 1600 crores for the coming 5 years, you will see lot many activities happening in this digital front. The blueprint is there in the form of digital blueprint. As and when things are evolving, you will see lot many things which have been envisioned in the architecture would be implemented. Over to you. I will stop here.
Uh, Taking cue from what you've said, the interoperability part, many people working in silos and the integration of all those things together. How do you think that the states are prepared to implement National Digital Health Mission in its true spirits? Because there will be challenges, private participation, state governments coming together. So, where do you think that how that blueprint can be made that the smooth implementation of National Digital Health Mission? I think there are two, three states or UTs where the preliminary pilot have started of NDHM.
Yeah, as I mentioned the opening remarks, that means digital initiatives are already there in the form of this A&M using the online portal. In the TV program, you are having Nischay platform. In IDSP, you are getting information. You are having Mera Hospital program. You are having e-Shushruth catering to the hospital and other thing. That kind of initiatives are there. And in NHM, you are having a lot of scope for innovations, and the states have been promoted and facilitated for carrying out such innovations. That's why in few of the states you would be seeing that lot much progress has happened. In some of the states, they are still going in that direction. Nevertheless, states are nudged and they are facilitated to do innovations and adopt digital technologies. The A&M thing they have adopted, the IDSP program which is there, and you have seen the result of the IDSP program. It's not that the architecture is not there. The results of the IDSP program, you have seen how we have contributed to the management of the COVID pandemic. The other architecture which has evolved side by side IDSP is the COVID platform. Previously, we had the sense of that with the form of having the e-win platform, which was used for logistics management of the erstwhile immunization program, the child immunization program. That has been expanded to cover the adult immunization as well as beneficiary management, session management, everything. The states are now having that kind of facilities. These two platforms are there, and this IDS, apart from this IDSP platform, we are having another platform, Integrated Health Information Portal. This integration health information portal, in which all the other programs, if you look at the way for every scheme you are having a portal. Now this integrated health information portal, it will bring all the people together on that portal so that it talks to each other. So that kind of just a minute. That kind of thing is already being done. That is already happening. Uh, in the coming days, with the strengthening of the surveillance, we will see more of this. Now we are primarily shifting from the IDSP to the integrated health information portal. Around 11 to 12 states they have already started using it. It's a it's a modular based system with which can throw a robust kind of analytics which can be put into action. Surveillance is information for action. So that kind of things are already built in. It- on this platform, the TB program, the malaria program, the NCH program, and the other information can also come, and this all will talk to each other. Side by side, the PMJ 2.0, which caters to the secondary and the tertiary care for the beneficiaries of PMJ. So that can there's a how to link that with the existing Ayushman Bharat Health and Wellness Center, which would essentially be riding on this IHIP platform. So we are trying to see that how the linkages become so that the continuum of care is ensured. This thing, and the states are very much partner into this. We are moving around the states. This digital platform, the digital mission, would be a highway which would connect all the roads from the states and other things. That kind of vision is there, and we are moving in that direction.
Right, right. I'll just take. I just want to have another perspective from you on the rollout of Health 4.0. Especially we may talk about the Health 4.0, emergence of new technologies like AI, robotics, blockchain. There are many. And since in this event, a lot of industry leaders, health tech startups are also part of this event for today and tomorrow. Uh, I just want to have a perspective from you that what is your opinion on the power of Health 4.0, which can transform the India's healthcare story? Your thoughts on that, sir?
You see, if you have having witnessed the pandemics earlier also, you see the difference between the earlier pandemic H1N1 pandemic and this one is the information. And people they have used lot of applications, lot of tools for uh, triangulating the information, bringing out more insights so that a better management can happen. You see that how the technology has played a role just opening up the telemedicine guidelines. It has seen that how the telemedicine has become an industry now. It is growing. Though things are happening in silos now, we are trying to see that how the quality and the standards can be built into that. In the coming days, you will be seeing lot of use of analytics, the use of the medical devices and other things. In COVID, there was no treatment, but you see that how a small device like this pulse oximeter, it has been a game changer for management of COVID during this, because no, you can't raise the number of beds manage the patient if that parameters which are available, which can be monitored at the home front. So that kind of thing has happened. Now you see the home oxygen therapies. It has gone to that extent that if the oxygen is level is less, you can have the oximeter. I'm just you can give oxygen when till up to a particular level, and that kind of guidelines have been tweaked along with the use of technologies. In the coming days, with the aging population and which more or more chronic conditions which are coming, which have to be managed at the on an ambulatory basis, you will see lot and lot use of technology in the coming days. So there is a lot of potential that we have to see that how we innovate and see and cater to the needs rather than making a product and seeing that how the needs are catered to that product. No, we have to see that these are the needs which are to be which are to be which are to be catered, and we develop our technology around that thing so that the acceptance of that thing is very fast. The examples of your meters and your pulse oximeter and the oxygen oxygen machines at home, because that was meant to cater to the needs of the people, not based on that the patient would be coming. In the medical parlance, there is a saying that the patient doesn't read the book. The books are written after seeing the patients. Apart from that, for anything as envisioned in our national health policy, we have to think big, we have to start small, but we have to scale fast. That's the whole paradigm on which the national digital health mission is think. That is thinking big, starting small, but expanding, scaling up very fast. With that paradigm, I think in the coming days you will be seeing many things happening in the technology front.
Right, right. I think it's an apt line to end this conversation, that start small, scale up fast, and aim for a higher goal. Thank you so much, Dr. K. Madan Gopal, for joining us in the inaugural of APAC HealthTech Innovation Conclave. Thank you so much for joining us. You're the senior consultant from the NITI Aayog. But before we let you go, we have a small token of recognition for you. Can we have the award certificate on screen, please? It is indeed our honor to present you with the Health Tech Impact Award 2022, sir. This award is proudly presented to you for your leadership role in the healthcare sector. It is indeed our honor because we all are working together to build that digital resilient healthcare ecosystem. Thank you so much for joining us today in the inaugural, Dr. K. Madan Gopal, Senior Advisor, Health Niti Aayog, Government of India. Thank you so much. With this, we come to the end of the inaugural session of the fourth edition of APEC Health Tech Innovation Conclave. We had three perspectives, one from the NITI Aayog Government of India, and one from the state of Andhra Pradesh, and one from the state of Kerala. And with this, we come to the end of the inaugural session. Do join us for the industry presentation at 11:30 a.m. today. Thank you so much.